Periodontal disease is known to be associated with coronary artery disease as well as poses a risk for bacteremia and subsequent risks. A recent report looked at 6,707 participants of the Atherosclerosis Risk In Communities study who had full mouth periodontal examination at visit 4 between 1996 to 1998 and longitudinal follow-up for incident heart failure. Data on incident heart failure was checked from visit 4 to 2018. In addition, data on incident heart failure with preserved ejection fraction and heart failure with reduced ejection fraction between 2005 to 2018 was also analyzed. Periodontal status was classified as healthy periodontal disease or edentulous as per the periodontal profile classification. Association between these periodontal profile classification levels and incident heart failure with preserved ejection fraction, and heart failure with reduced ejection fraction were calculated. Biomarker of inflammation CRP and biomarker of congestion NT-proBNP were assessed. Of the total 1,178 incident heart failure, 350 were HFpEF, 319 were HFrEF, and 509 of unknown type over a median period of 13 years. 59% of these cases had periodontal disease, while 18% were edentulous. Both periodontal disease and edentulism was associated with increased risk for all varieties of heart failure. In addition, edentulism was associated with unfavorable change in CRP and NT-proBNP, while periodontal disease was only associated with CRP. A scientific statement from the American Heart Association in 2012 had concluded that observational studies supported an association between periodontal disease and atherosclerotic cardiovascular disease independent of known confounders, but they do not support a causative relationship. Another conclusion was that although periodontal interventions reduced systemic inflammation and endothelial dysfunction in short-term studies, there was no evidence that they prevent atherosclerotic cardiovascular disease or modify its outcomes. Though inflammation is a physiological protective response intended to provide protection and promote healing, sometimes it can be counterproductive. Inflammatory cytokines exert direct effects on myocardial cells that predispose individuals to heart failure. A randomized study of 58 patients with type 2 diabetes mellitus and periodontitis has shown that non-surgical periodontal therapy may improve cardiac diastolic function in type 2 diabetic patients with periodontitis. Authors of the current study concluded by saying that if future studies provide causal association, population-level implications could be notable given the high prevalence of treatable periodontal disease and the burden of heart failure in the aging society. First set of journal references. Third reference. Two more references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.